Well, welcome back to another installment of Lady Leaders series where it is not just for ladies. I think we have now successfully branded that. It's just the name of the webinar, but I'm super excited because I have two of my favorite people who I have known for a real long time who get to join us to discuss the super hot topic of hygiene from the front lines right now. And so I'm going to for people who don't know, I'm going to let my two hygienists who've been with me for a long time, Amy and Kylie, introduce themselves for those who don't know. So, and Ashley, by the way, welcome back to Lady Leaders. I don't introduce you because at this point, yeah.
We're at the end of the year. Most people know us by now. So yes, thank you so much.
Yes. But all right, Amy, I'm going to start with you.
Right. I've been a hygienist for 27 years, working with Dr. Casmel since 2004, and I work out of her Eagle practice.
And I'm Kylie. I've been in dentistry since 2013 and been the lead hygienist at our Avon location since 2018.
So that's a little bit about these two exceptional ladies. And, I was excited because as I put this together, one, I'm going to go off script, ladies, for just a second. So I giggle because I always put together a real loose agenda, but I joked with them because they're hygienists. I put together a very in-depth agenda because hygienists, they very much like to know what's going to be coming. So I knew that, but I had to giggle. But when I was going through it with them and just kind of running through what was the goal of this, the more I talked with them about it, the more I think excited I was getting to hear from them. So I'm excited for everyone to get to hear from these ladies. But, the first thing that I told them I wanted to start with was, everybody knows I don't personally have social media, but I know that on a lot of social media platforms, right now, hygiene is just an incredibly hot topic. And it's actually kind of hot button that, I find that there is a lot of maybe misguided information about the state of hygiene. And some of it's real, some of it's very, very true. But I was asking them because I know they at least, are in the hygiene community. They talk to other hygienists. And I said to them, what is true and what is maybe false when it comes to what we're hearing about hygienists and the state of hygiene right now. So Amy, I'm going to start with you.
So I think one of the biggest frustrations that we hear about is, the things that hygienists are asked to do in the hygiene appointment and maybe just not feeling like they have the time allowed, to really do a good, thorough job. And then, on the flip side of it, I think what we see, and I see how it happens is, there might be two hygienists working in a practice and one hygienist is using the full hour, doing everything as thoroughly as they can. And then there's another hygienist that is getting, all the things done in 30 minutes and walking the patient up. So then the office manager sees that it can be done in that amount of time. And so just slowly they start to maybe schedule those, that other hygienist that does take the full hour for like shorter visits. And then they're still trying to do all those things that, are expected. But they're just feeling like they have less and less time. And so I see on both sides how it happens. If an office manager sees that a hygienist isn't actually using the full hour, then we can maybe put more patients in those spots and utilize those times. So yeah, I think that's the biggest one I've heard.
Well, and what's funny is when she was kind of briefly telling me about this, I thought, really, so it's not necessarily hygienists are all out there saying, we demand more money, we demand more, breaks or whatever. I'm like, and they were like, not really. They were like, the hygienists that we, correct me if I'm wrong, but the hygienists that we know that we, are like us, passionate still about patient care, truly care about our patients. They said, it's not so much the money as, being in a culture where there's enough time to get done what we want to get done. Mm-hmm. And I was actually kind of surprised, and Kylie, I'll let her chime in, but she was like, it's not that those hygienists who just keep wanting more and more money aren't out there. But she said, that's not really the thing that they see. It's more, and I think it wasn't that hygienists are asking for 2 hours for everything. Mm-hmm. They're more so saying we just want the appropriate amount of time to really get done what we want to get done.
Yeah.
Correct, Kylie?
Yeah. And kind of to your point, like, yes, there are those hygienists out there, I think, that are trying to capitalize on the lack of hygienists there are, and we politely pass on those. But for the majority, they are wanting to do a good job and give good patient care. But the phrase I hear the most is, we have so much to do and not enough time.
Mm-hmm.
And then I think there's too just frustration of a lack of kind of expectations. It's not clear of, okay, so what exactly do you want me to get done in the 60 minutes? Because I talked about XYZ, but you're mad I didn't talk about ABC, you know? And so there's just a lack of clarity of what truly is the standard.
Yeah, which is fantastic. And we're actually going to jump into more for sure. But Ashley, anything you have to contribute to that? Because you see things from a different point of view when it comes to, you know, this topic.
Well, first of all, I just have to say I am loving just having you guys here as this point of view. Like, this is something we don't get to do a whole lot of. So again, thank you for being here, because I think it might be challenging too for even, you know, some people to like ask their hygienist specifically. So you may be even giving them ideas of like talking points. So anyway, I'm just giggity about this whole webinar. I think to Kylie's point too, you know, it's the establishing communication, you know, and my side has kind of been more like admin side and operations side. And so, you know, it's building that good communication, I think, between front and back, and also with your owner doctor, your office manager, and understanding those expectations. I think that's a really good point. But making sure that your, you know, hygiene team and your front office have really strong communication, and they each can understand each other's roles, so they're not fighting against each other. That's something I have seen as well.
Oh, for sure. Well, and it's funny is, as we were kind of discussing Amy's point of, she was like, I totally see how an OM would see one hygienist can do things in 30 minutes. One takes the full 60 minutes. Well, that one who's taking 60 minutes must be slow, you know? And so that, and she said, she was like, but I see it that OM's not trying to do anything.
Right.
They're just trying to make it to where they can actually have the most productive schedules. And when Kylie was listening to this, she kind of said, well, guys, I get it. She was like, so she was an assistant here in our office, went to hygiene school, got a different job for the time being, and then came back to join us when we had availability. But when we were sharing that story, Kylie told them, when she was like, I understand how that would happen.
And I think just lack of standards and expectations, and then sometimes people, so like when I joined my first job right out of school, you know, I was excited and jazzed, and I'd seen what you guys did here. And so I was ready to put it into practice. And the other hygienists onboarded me, and they trained me and showed me kind of what they do and what the protocols are. And I just found over time that there wasn't much protocols. You know, we didn't even hard chart for new patients and the existing work that was there. Those new patient appointments were 60 minutes. Even though they were scheduled for 90, it wasn't uncommon that I would finish in the 60 minutes because we weren't hard charting. We didn't do FMXs. Treatment planning was minimal. Sometimes we perio charted, sometimes we didn't. It was only if there maybe was inflammation that we saw. It wasn't expected. Recession and mobility wasn't expected. And I went with it. That was against everything we learned in school or that I had seen before, but okay, this is the protocols. And I was kind of shy too, because it was my first job. The hygienists had more experience than I did. They had been there longer. I didn't want to step on toes. And so I went with it. And I did find myself just complacent and kind of not loving what I did. And I'm like, this is it. This is my career. And I did it every day, but that's where burnout happens. Well,
and what's funny is you had been out all of 18 months.
Yeah.
And when I came to her, and I was not trying to poach, for the record.
That's what they all say.
I mean, do I love Kylie? I'm not gonna lie. But I did just say, like, hey, truly, if this is something you know of anybody, whether it be you or anybody who would be interested in, and she just jumped right at the opportunity to be able to do what she saw Amy doing when she was here. But you know what I thought to myself was, you know, how crazy is it that you can take an extremely passionate hygienist, put them in the wrong environment, and they will absolutely take the path of least resistance. And it was all for lack. And I don't think the hygienists she was with were necessarily bad hygienists. But what's crazy is there's a direct correlation to lower standard of care actually leads to higher burnout. I found that actually really interesting. Is we think that maybe when they were sharing this, all these light bulbs are going off, that I was like, man, here we are thinking keep taking more off their plate and don't have them have any standards and they'll be happier. And really, for good hygienists who are passionate, it's the opposite. It's like, I want to know exactly what's expected. I really want to know what the perio protocols are, which I know Amy's going to get into, but like the good hygienists who actually have conviction and care about their patients, they want to know what to get done. And the more the standards help them do that, and given the right amount of time to do it, it actually helps them stay more energized, which I thought was interesting. I don't know, Ashley, what do you think?
No, that makes me so happy. And I think I'm that type of person in life too. Like if I know what my goal is and if I know what the standards are, then it's more satisfying, you know? And then especially too, when you came out, you were out of hygiene school all ready to, make a difference really.
Yeah.
And then nobody is caring if you are like, oh, that would be lame, you know?
Yeah.
Yeah. And that's what I found so interesting when they were talking about it, is like, yes, social media might portray one thing, but their point was like, actually, like there was nothing about that when they came in. And that's why I get a little emphatic where I'm like, I don't have those hygienists, like, and I mean, yes, do I think they're unicorns? Of course I think they're unicorns, but I think, I think there's other ones out there, like,
Well, a
I think
unicorn has to be given space to grow, right? Like,
yes,
that's the key.
yes. And I'm like, I am certain there's other little unicorn hygienists out there all over the place. And I think they're created, to Kylie's point.
Mhm.
Sometimes they come out not sure if they're, not sure if they're a unicorn, but dependent on the environment you put them out on or in, we can help to grow them. I'm going to stop using the unicorn analogy because I don't know how to keep going with that one, but but anyway, I loved that when they were saying it, and I couldn't wait to share like how interesting I thought that was. But so moving on, like I think we all agree that there are hygienists out there who really do love patient care. And if you're noticing that maybe you're one of those offices who is having some level of complacency because maybe post COVID we did let the standards just kind of start to slide a little bit. Amy, what would you see? Because you've been here so long with me. We've reinvented the standards over and over. What would you say are ways that doctors can approach their hygiene team feeling comfortable about discussing, like, hey, our standards have gone down? Or, one thing I joke is like, doctors, please don't come to a hygiene team that's producing, say, 2.2 times their pay, and you now know that number. And if you're seeing the standards are dropped, I always joke, like, doctors don't come out with, hey, the metric that you're supposed to be producing at is 3.3, you're not, you need to become more productive. Like I always steer clear of any kind of that conversation almost now too. Like that's not even a part of, they know that, but that's not even part of the vernacular. And so I was saying to Amy, we've gone through so many revolutions of raising our standards or changing our standards. I'm like, what for you was the ways that has been helpful for you?
I can remember back to when we very first kind of started changing our philosophy of care, and it was like a group effort. Like we were all involved in like I think we called it like the healthy mouth baseline.
Mm-hmm.
And we all just kind of started talking about all these different parts of oral health that we agreed upon that like this is not considered healthy. And if you see it in a given day, exam, whatever, we're going to bring it up to the patient. And so it started off with that. And then it's kind of just evolved over the years into these pillars of health for our office. And first and foremost, I think we came up with, soft tissue being one of the most important because that's the foundation of everything. And then now we have obviously hard tissue and soft tissue are the kind of main ones, but we've added as years have gone on, like occlusion and sleep and aesthetics. Yeah, and missing teeth, because in our own office now we can offer implants and stuff like that. And some of these patients were going around with a missing tooth and we didn't offer it. So we weren't really, getting into that. So now we kind of have just a set standard of like, this is all the things that we're looking at every time we see this patient. Well, so we might not go into depth on every single one of them. We found that, we want to kind of get the soft tissue healthy first, and then we can kind of start looking into those other areas. But we'll at least bring it up to the patient, and kind of educate them on why we're looking at that and why it's important. And then, for this whole thing to happen, it took the whole office to be involved in it, having input, having buy-in, understanding why each point was important. And then like when we started to really dive into the soft tissue, that was kind of the hygiene team really looking at what we considered, a healthy mouth as far as the tissue is concerned. And then if the patient presents with, maybe 30% of the mouth being inflamed or bleeding or whatever, like we have a set standard that everybody's going to kind of treat it the same. So it doesn't matter which hygienist the patient sees. We have a perio protocol for like how to steer and navigate those appointments. And I think that really helped a lot.
Just creating like a flow chart. If your patient exhibits with this, we're going to diagnose this and use these codes. And then if they exhibit with this, and it just kind of, it's truly just a flow chart of what they exhibit with and what codes to use. And creating that together as a department was actually really fun and interesting, seeing different hygienist point of views too, because there's so many different ways you can argue and see things. And so by getting everybody's kind of different perspective and how they see it, what they would diagnose, coming to kind of a conclusion of what would be best.
And we used the AAP guidelines, the staging and grading, and that kind of was our that was what we used to kind of decide what we were going to do. We didn't just
yeah. It's funny, Amy, through mind as I was like, I did not just be like, hygienist, make it up, and I get that question a lot in regards to like, okay, so what I'm hearing, Summer, is you want us to recreate the standards. I call them pillars. I tell people call them whatever you want. But if you're trying to, take hygienists who maybe right now been on the front lines, some of the standards have started to drop. We're hearing that sometimes all it takes is helping them understand what's the maximum impact we can have with our patients, and sitting down and redefining that. But I tell people, like, I had hygienists who were, as you heard, they were really into it. If you don't have that hygienist, then doctors, I'm like, then do it yourself. You look at the AAP guidelines, you figure out, what do you want the standard to be? And then you go sit and present, this information. I was fortunate. I had hygienists that I could rely on, and I could co-create it with them, or I could say, hey, this is the first pillar that I think is the most important. I'm going to let you do what you think looks best there. But if you don't have hygienists like that currently, I would not just hand it to them. Because as Amy said, you don't want them just to make stuff up or what have you. But, to Kylie's point, like in her first position, I mean, she was saying her perio percentage was what, 6?
It was, yeah.
It was like 6%. And she said, but I had no idea where that was supposed to be. And she tracked it all on her own just because of who she was. But she was like, I didn't really know out of school where it should be. So I think these pillars, help hygienists understand how much more perio there actually probably is. And I tell doctors, I think it always starts with us, defining what those pillars look like, which go back to one of our other webinars. We went through all of this, but, really defining that for yourself, what really matters to you, what in your mind is really going to be the most impactful stuff you can do with a patient. And that may not include right now implants or sleep. So like I say, your pillars might be 4 or 6 or whatever, but, expanding that education is going to only make you change those pillars over time. And then keeping your hygiene team fully aligned with what are the standards. And, for us, our hygienists find it the most successful to take those standards, those pillars, and they just have it at the bottom of every single route slip. So they have the patient information on top and the expectations for those pillars on the bottom. And they may not hit all of those pillars, as they were saying, every patient, but they know, okay, I got through pillar 3 today with the patient. next time they come back and they're healthy in those areas, then we'll kind of move forward with if there's anything else in the other ones. But I think if you're trying to reinvent your department, starting with the standards and seeing the level of commitment and excitement that your hygiene team may have for them is kind of the first step, not production. It's the standards first there. So anything that came up for you as we were chatting through that, Ashley?
I mean, yeah, like you said, I'm going back to all previous webinars, right? Where it's about Amy, you hit it on the head, getting your team's buy-in on the systems that you're creating, because I've learned, or I have had systems thrust upon me where I'm like, why am I doing this? It just doesn't, like, you have a system, you don't know my job. Like, that makes no sense. So getting your team's buy-in is super helpful. And then to your point too, Summer, like, yes, if you don't have a, team who can put them together, that goes back to a deeper question of why aren't they motivated in any capacity to do that? And so the biggest thing that I have found there too is, we've talked about it before, is like there's power and vulnerability. And it's not like, hey, I need you to put this system together. It's, hey, I need your help. Like, we need some help here. I want us to, you have to get them to rally around the why of why you're doing this, not just like, this is another task outside of your normal job description to do. So I know we could harp on that we have harped on that for other webinars. Those are the little things I'm picking out.
Well, and I
like,
think,
or sorry.
oh, no.
I was gonna say, like, we talked about kind of a little bit yesterday, like, by going through those standards and kind of, it reignites that passion a little bit of like, this is why I do what I do. I do it for the patient care, to build those relationships, to help make a difference and turn their health around. And so when we actually do start diving deeper into different levels of care and what all we can offer our patients to make a difference, again, it's just that passion comes back. This is why I got into the field.
Which, by the way, that segues beautifully. I'm so glad you thought first. Which, to my point, was going to be, as a doctor, as you're laying out these pillars, for me, it always comes back to being able to say to hygienists, like, this is pretty great that we get this opportunity to take somebody who's sick and help make them well, and take somebody who has inflammation in their mouth that's now going all throughout their body, increasing the chances of all these different cancers and cancer. Did I just say cancer? Cancers and cancers and all other different things. And you guys get that chance to truly help make them healthy. And I will say, it's never met with a hygienist by and large being like, yeah, not really. I don't think I want that. Now these two are extraordinarily, like, they do get excited about it. And we have some that are maybe not quite as vocal about it, but I will say, to your point, Ashley, if you're digging into this and your hygienist team is kind of like, wah, wah, then it may be time to question, do we have the right hygienist to take our, this department to where we're looking to go? And I do think there's ethically standards of care that we have to follow. So if I don't have hygienists who want to, ethically, I can't keep them on the team for me. And I think part of what we want to discuss next when it comes to hygiene on the front lines is, if you have the right team of hygienists that are, at least they can all say, we're committed to these standards. That's the next step. You have to get buy-in, truly, like, hand stacked, we all commit to this level of standard of care. The next part of it is vulnerability. You may have hygienists that came from someplace like Kylie, who have been hygienists for 10 years, who aren't going to be comfortable always saying, I don't know sleep. I don't know this. I don't know this stuff. So sometimes, we're going to get patient objections regardless. Right now, I'm going to have them discuss here in a second what are the main ones we're hearing. But it's good to be able to review with your hygiene team, what are these different standards of care? And if you don't know them, it's totally fine. We didn't either not that long ago. So let's review what each of these pillars means and how to talk about them, but then discuss what are going to be the patient objections. How do you overcome them? You need to practice those even over and over. And so the next thing I wanted to kind of dive into is, as you're trying to kind of recalibrate and raise the standard of care of, say, your hygiene team, with what's going on right now in the front lines, what are we seeing as patient objections currently to some of those pillars that I know we have in our office? Amy?
I think the biggest one I've seen recently has been like no on fluoride. Just with all the latest stuff that's come out, it's kind of going to the masses, and people are coming in thinking that it's like a toxic thing, and they're just not. They're even avoiding it in toothpaste at home, like seeking out products that don't have it. And so that used to be a super easy one for me. Like everybody did fluoride.
Yeah.
So that one's been hard for me.
Yeah. Yeah. Well, and how do you see? Because there for a bit, we thought maybe it was just our verbiage or we were just having, we tried a few different things, but now we've kind of the pendulum has swung, which we were talking about. And you want to tell them what we're doing?
Yeah, we're trying to figure out a like a hydroxyapatite varnish that could be like an adjunct for those patients that need help with remineralization. They're not going to use fluoride, but what is out there that we can use that we can recommend for them? So like MI pastes, or there's I think it was fig was one. So we're definitely trying to think outside the box and come up with other ideas on how to help those patients, just in ways that
Give an alternative
we didn't have to before.
Yeah, because it's happening. Yeah.
Mhm.
And I'm not here to say that maybe we will find out that I don't really know. I never say never, but I would just say now more than ever, fluorides are way lower percentage wise for adjuncts. And so we've had to figure out how do we figure out alternatives. What else do you guys see?
I think one of the big ones I get is just, does my insurance cover it?
Yeah.
Patients are so quick that I only want what my insurance covers. I want my 2 free cleanings a year. And, so that just again circles back to like patient education.
Yeah.
So using whatever diagrams, whatever models, showing it, having the IO photos and x-rays, and truly taking the time to walk them through the explanation, and then feeling confident in what we're diagnosing and what we're recommending for treatment. And then knowing too, like the team has each other's backs because everyone has that buy-in. So I know if I tell a patient, you can't just get your free cleaning, you need an SRP or something along those lines. I know if they get angry and want to talk to the doctor is going to come in and go, I see exactly what Kylie's saying, and I agree. And so everybody will kind of all rally around together.
Yeah. Well, and I think that's something that we have to consistently practice though. And as we bring new hygienists in, we have to re-practice our verbiage again. Because some hygienists did come from offices where if a patient said, I don't want that, they go, okay, I'll just do your cleaning. I mean, we just had that recently, and I think it's practicing the verbiage and having a hygienist recognize that they are supported by the team, by the doctor, things like that. Because I think, now more than ever, and we'll see post-election, I think with inflation and things like that, there is a lot of patients right now who are wanting only what insurance can cover, or they lost their jobs. So they really want the basic minimum. And we're not here to put people in any kind of financial bind. But, as they know, I will not start preaching, ladies, but I have this thing of like it is our ethical obligation to tell people what's going on, and what they choose to do with it is up to them. But we all took oaths to really do no harm. And I think it's important that we do walk into every single exam. And if we see inflammation, we call it as such. If we see, decay, we call it as such. And, I think there's a way to be able to do it in an incredibly compassionate way with patients to where they know that you care. But I think we've all kind of grown up in this culture of like, we've got to tell patients what's going on. And sometimes it's uncomfortable, but we have to be able to do that and then find that, trust our TCs to figure out how to fit it into their budget for them.
And it is hard, like coming from the office I came from, and I felt comfortable in talking about it. Like I could explain gum disease. I had to overcome the obstacle of fearing that patients were going to get angry with me for some reason. And I think that's a big roadblock for a lot of hygienists. I think they worry like, oh my gosh, this patient is going to get angry because I'm going to tell them, I'm going to be honest with them, tell them what they need, and then it's going to cost them a lot of money. We build this story in our head that they can't afford it, they don't want to pay for it, now they're going to be mad at me, and then they're going to leave a bad review, and then it's going to come to me, and then you just start spiraling. And but at the end of the day, like you just said, like for their health we're their healthcare provider. We have to be honest and educate them. So I think like for a personal hurdle is overcoming that. How do I talk to my patients about it and overcome that fear? And then two, incorporating something new. I've been seeing Bob for 10 years and we've never talked about fluoride. How now am I supposed to bring that up? Without it making it look like we haven't been doing him a service this whole time.
Right.
So
Right.
I think those are our own obstacles.
Yeah. And, you know, to that point, yeah, I hear that a lot too, is hygienists say like, you know, so now we're trying to raise these standards, you know, and all of a sudden you're wanting me to talk about their bite. And I've been seeing Bob for 10 years. I've been looking at Bob's bite for 10 years. How am I now all of a sudden going to say, hey, Bob, you should do Invisalign? You know, like I think hygienists, that's a huge thing. And so helping your hygienist understand, like, how do we talk about this? And, you know, the phraseology we all say is, you know, Bob, I have been seeing you for 10 years. And with what we now know, you know, as technology has changed, as research has changed, as we go to more continuing education, what we now know is what I've been seeing here. This is unhealthy. And the good news is we can help you with that. We can help correct that now. We have the technology and the tools to help you with that. And I'm excited to talk to you about it. But it's funny, like stuff like that can roll off of our tongues so easy, but it only did because we practiced it. And then they would go out, they would fumble, they would have people say no, they would say some real funny stuff that made me laugh pretty hard. And then you know, they would come back and we would say, and that's okay, let's practice again. But I think, you know, really what we're saying with hygiene on the front lines right now is things are changing slightly. We can all feel it. We can feel that treatment's being accepted a little bit differently. You know, fluoride's definitely decreasing. Some of those adjuncts that you guys used to not have to think about, lasers and things like that, that you're now having to really change the way you talk about it. And I think more now than ever for hygiene doctor teams, I've been really pushing with the doctors, ensure that they understand future consequences of pain and money. Yeah. Sometimes they don't realize the longer you wait, the more costly this is getting. It's never going to cost less than right now. And patients really understanding that. It's funny how sometimes they choose to actually, oh, I had no idea. Patients are unqualified to determine their own treatment plans. You know what I mean? They don't know the consequences. They have no idea.
All they know is it doesn't hurt.
It doesn't hurt. Yeah. Yeah. So I think, you know, more now than I think even ever, we're having to really discuss more the long-term consequences of doing nothing now and making sure patients know that. And I say all the time, like, you can be proactive or reactive. We're here for you either way. It's just going to be way cheaper with less chance of pain if you're more proactive. And I would say hygienists being all in alignment, that they agree to that standard and that we agree that insurance is not going to cover everything. We agree that, you know, protecting the roots with something like, whether it be fluoride or hydroxyapatite, it's important. I think that has to be a commitment on everybody's part. And you all have to agree and be able to practice the verbiage of it. So, Ashley, I don't know, anything checking in there from what you're hearing?
I can only just emphasize the unified, you know, strategy across the team, you know, from your assistants up to your doc, and how important it is. Like, you know, Kylie mentioned that you know that your doc's going to come in and support what you just said. Like that's what a team does. And with regards to the case acceptance thing too, on the CSI webinar we just had earlier today too, one of the things Dr. Doon mentioned is, you know, one of the ways that you can get patients to understand is by explaining, oh my goodness, I just forgot, is by explaining, like, I would be doing you a disservice if I also didn't mention, you know, we're doing this procedure now, but there's a solid chance, you know, in 2-3 years, this might need to get replaced, or, you know, we're seeing this now. I would be doing you a disservice if I didn't mention now that this is going to get worse, or, you know, just mention, you know, being very blatant about what you see. And then I absolutely love what you said about with what we know now. Like, that's the thing, man, I love science. Science is excellent. The good thing about science is that science knows it's also always changing. You know, we learn new things all the time. It is not set in stone. And yeah, just that phrase, with what we know now, that is, that's gold.
Yeah, because it's true. I mean, you don't go to a medical doctor and they're like, bringing out archaic,
Yeah,
technology.
they're not putting leeches on me to get rid of my
Yeah.
With what we know now, we don't have to do bloodletting.
Yeah. Yeah. And if you want that, this may be the wrong place. We've had some of those. We don't have that here. Well, and I think that brings up a great point. Hygiene from the front lines right now, if doctors are feeling a little bit cynical or what have you, my hope with this was, not to say, well, lucky Summer with her unicorn hygienist, or my hygiene team is
Must be nice.
yeah. I'm like, no. Like, I actually think, we've had some temp hygienists we were saying that had this exact same level of care. They just needed our standards. And once they came into our office for those months that they were here as temps, they were like jazzed about the standards. They were excited to be able to provide that
We were
level of
wanting
care.
them to stay.
Yeah, I know. And then they just moved. But but I guess what I'm saying is that was my whole intention is like hygiene from the front lines right now might be, I think there might be some more really great optimism around because I joked like the really great hygienists, they just aren't as loud. I said, like they're doing the work. They're with their patients. They're trying to do incredible jobs, with their patients. And I know that these two don't speak for all hygienists. And I know, they're not steeped in social media constantly. So I'm sure they're not probably that kind. But nonetheless, I was like, what are you hearing or what would be your sentiment on what makes hygienists feel truly supported? Because like I always joke, like we all get paid in two ways. I think I learned this from Alistair in the money that we get, but the culture that we're around. Like there's two ways that we're actually like we actually feel loved and appreciated, and they're both important. So like as hygienists, a question I had was, what makes you feel like you are loved, supported by the team? You know that they've got your back because you guys are not diva hygienists. They do not expect people to do everything for them. But like, what does that feel like for you? How do you know you're in a supportive team that has your back, like you guys said?
I would say kind of just knowing you're in that safe environment to fail.
Mhm.
Like you said, we've said some pretty ridiculous things, trying out new systems and methods and a little clunky with new technology or machinery, but knowing that we have that opportunity to practice on each other during lunch or lunch and learns and doing rehearsing verbiage and stuff during meetings. And then when we're with a patient, feeling comfortable to give each other feedback with no judgment.
Mhm.
And like, yeah, that landed horribly. Totally fine. It happens. Here's what we can do next time.
Mhm.
There was no shame or
Mhm.
kind of punishment or anything like that. It was just, yeah, you were trying. Let's
Yeah.
keep trying.
Yeah. Boy, if we had a chance, I'd love to do the outtakes of some of the funny things we've all said. It would be hilarious. Dentistry is so dang funny. Did you have any that popped up?
I was just gonna say, like, if like we do bring up something that's not maybe that big of a concern, just edifying us and being like, oh, good catch. Like, hey, we're gonna put a watch on that. And, instead of being like, oh no, we don't need to worry about that. Like, let's do watch that. That's a good catch. And then just edifying anything that maybe during that appointment we did discuss, really driving home the importance of the periodontal disease and the need for the therapy, or even just like the fluoride treatment. Like when the doctor comes in and also says, like, I really recommend that fluoride for those incipient lesions or for that sensitive spot. I mean, it can be so quick, but I have found that makes all the difference in the world. I'm, like somebody that's kind of on the fence on it, that usually is enough to push them to say yes.
Yeah.
So
Hearing the doctor say it holds so much weight.
Mhm.
it
That
does.
it helps.
Yeah.
Yeah. And then I think too, me and you kind of touched on it, like support just with scheduling and stuff is trying to not eliminate because it's gonna happen, but trying to minimize the make it work mentality of, oh well, we scheduled it like that, so make it work. And it's like I will, but can we not make a habit of it?
I was just when Kylie said that, that always makes me laugh because doctors sometimes do the same thing with running over in lunches all the time. And they start with, I joke, like one of them, and then all of a sudden it's like almost every day they're making it work, through lunch. And I just said, I think either change your expectations, or and say, every day we're going to be doing this, or just expect this to happen, instead of like, hey, just today, can you make it work? 'Cause they were like, we don't mind doing that once in a while, but if every day we're having a make it work moment, we don't want to keep making it.
Right.
Well, and I don't want to understate, the importance of, truly, that in my opinion, the best hygiene teams are supported by the best front office, the best assistants, and the best doctor. They're not divas, they're part of the team, but they're not a siloed off part. You know what I mean? Like our assistants are happy to run by and grab their tray, or if they're really trying to add treatment, the hygienists or the assistants will be happy to, help them move over to a different room and finish stuff up. Our TCs and our front office are happy to try to help change something if need be. And I think too, they have doctors who absolutely, if they went to them and said, hey, you totally let me down here, you left me hanging, I talked about this and you didn't back me up, our doctors, I think, would all be like, oh man, shoot, I didn't, and I think that that's important, because hygienists stop trying, I think, and they do start to go to the lowest common denominator if they feel like they're not going to have that support. It's hard to want to be great if you're not surrounded by people who want to also have that level of greatness, I think. Well, and I just wanted to close out with, okay, so doctors might be listening to this, or OMs, or whoever's listening to this, thinking, okay, so, there are hygienists who are passionate. Maybe by lowering the standards, we've actually increased the level of, dispassion towards things. So maybe it's time to kind of bring that hygiene department back up. Okay, we'll redefine the standards. We'll give them the right amount of time. We'll ensure that we have the resources around them to kind of help them succeed. How do hygienists, because this is a touchy topic, I know, how do hygienists come prepared for the day? Because you guys are both big into preparedness to ensure that you have, really successful morning huddles. Knowing you're looking at these pillars, knowing the standards, how do you guys come prepared for morning huddles? Like, what are you looking at? How long does it take? What do you bring to the morning huddle to help with it? Either one of you.
So we are always looking, like, I do mine the morning of, or I'll always be looking out like a week in advance for any, big issues, but then I'll take that to the front and just see if we can work out any scheduling issues before the day of. That's the worst, is when we come to the morning huddle and we're like, oh, this isn't scheduled right. Yeah. But I do my morning of. I think Kylie does hers during lunch. But we're just looking at patients that have outstanding treatment, patients that maybe had bleeding in a certain area that we really talked about, trying to hone their home cares into those areas. And if they weren't better this time, we might use the laser, or we might need to do some localized therapy. We're looking for those notes from before, and then we know going into the day that when Susie comes in, we might do a same day SRP in that quadrant if that hasn't healed. We're also looking at I'm trying to think,
like same day opportunity for doctor too. Like if a patient has
like
number 3 occlusal,
Mm.
okay, we can do that today. Doctor has a little opening right after the cleaning, and we could move them over, and just stuff like that we can talk about in huddle. Or like what Amy was saying, if us as hygienists are trying to, add in a localized or possible same day sealants, things like that, letting everyone know in huddle, hey, here's what I'm trying to do. So front office, if you could have a treatment plan ready, so we could just have that prepared and ready to go. Assistants, maybe if you could see my next one, take x-rays, and kind of just mapping out how that would work to get it taken care of. And then ensuring your room is stocked and has all the equipment that you need. You're not up running around trying to find the sealant material or etch, and it's all in your up, ready to go.
Yeah. But I think both of you, I mean, that's kind of your whole thing, is like, and that's the expectation of even our temps, like our long-term temps, they all come with that morning huddle prep sheet that you guys have. And it makes it so nice, because even if you're seeing somebody else's patient, all those same notes are in there, all that same information is in there, and everybody comes to the meeting kind of ready to see, how do we make it the most productive day. And I think it's nice because you guys know, hey, I might be adding same day SRP, like, I got to make sure I have anesthetic ready. You know, is there anything I'm going to need to ensure that I can just do it that at that time? You know, I think a lot of times that lack of preparedness just makes it to where, you
It's
know,
impossible to do it.
Yeah.
Because if you're getting up and leaving the room and grabbing stuff, that time that you could be working is spent looking for stuff. And if it's all in different scattered places, you know, which that's another thing we did. And I think we've mentioned this before, is we put all that stuff right in the operatory. So everything's within reach, you know, so we can quickly grab things.
And then like bringing up and huddle for those possible treatment plans. Could we have that one quad of SRP already treatment planned? And so that way in the moment, because it never fails, the TC is in the middle of going over something else or with another patient and you're like, hey, I want to do the same day treatment. Where are you? So it was already set up to begin with.
Yeah.
And then if you end up not needing it, you don't need it.
Yeah,
So
for sure. Well, and I think the nice thing is people always ask me, like, you know, well, do you care about their production? Do you care about if they take time to do, you know, huddle preps and things like that? And I'm like, not at all. Because truly what's funny is, and I really do mean it, if they're doing their part to prep themselves, they're going into the morning huddle prepared, they're adding that same day treatment. Both of these ladies are consistently at 3.3 times their pay or more, and they keep getting raises and they keep hitting the bonus. And, you know, I do get it. People who are in like massive PPO offices and things like that, there is challenges. And I have a whole thing I can talk about in regards to that. But I think if instead we're focusing on how do we take truly like great care of the patients, but have the biggest impact and really hone it in on even these first couple pillars that you have maximum influence on, what would that look like? They just do it, you know, like we were just talking last night as we were kind of thinking through some of this. And there's so many cool things coming down the pike that hygienists can be a part of, you know, whether, of course, whitening and hydroxyapatite and curidont. And, you know, Rachel Wall went through a ton of them, but like, it's not hard for them to necessarily, if you practice, if you get them excited, the production just kind of comes. Am I wrong?
No, it does. And then you just keep expanding. So you kind of perfect the basics and then you can add on top of that. So get comfortable talking about SRP and perio disease. And then we can start adding laser. And now we can start talking about perio protect. And now we can, and it just kind of keeps building.
Yeah.
And that's how you keep growing.
Yeah. And, you know, each of the hygienists kind of finds, is there little avenues of things that they love? And they sometimes dive a little deeper into that. And so that's where it's like, I think as we're kind of wrapping it up for hygiene from the front lines, you know, like I said, I think hopefully this got people actually more enthusiastic about, you know, the state of hygiene right now, and knowing that there are some really incredible hygienists out there, or they might even be like Kylie and they want to be amazing when they get out of school. They just need to get in the environment that helps them do so. And so we kind of discussed maybe some misrepresentations that might be out there right now. We talked about how do you potentially take your hygiene team and raise the standards a little bit if you're finding current status is not quite where you want. How do you know, support your hygienist to create a great team? And how to use morning huddles to help them prepare to be impactful to their patients. But Ashley, anything you wanted to touch on before we finalize?
No, I think you did that. Yeah, I think that was a great summary. I think just to add to that, you know, it's very possible, probable you have great hygienists in your team already, you know, just kind of looking for that guidance. And like you guys said, by setting those standards, you know, it can really help to elevate it. So I said at the beginning, but I'm just so grateful for this perspective. I'm not even blowing smoke. This might be my favorite webinar of the year. So yeah, no, what a great just kind of take on the whole hygiene system, basically the whole hygiene system. And so thank you ladies so much.
Yeah. Anything else you guys have?
No.
I don't think so.
Awesome.
Thanks for having us.
Yeah, thank you.
I think I might have to schedule you again because
I create the agenda 1 year advance. So
I know. Awesome.
all right. Well, thank you everybody for joining us. We appreciate your time and we will see you next month.
Awesome. Thank you, ladies. Bye-bye.
Thank you.
Yes. Bye.